Hello, everyone. Before I start, let me say that this meeting is being conducted in English, but we are also offering interpretation facilities in Spanish and French. Please press interpretation language button on your screen and select the language in which you want to listen to the discussion, en español, en français. Thank you for joining us today. My name is Sofia Sprechman-Sinedo, and I'm the Secretary General of CARE International, and I'm on the board of the International Budget Partnership. It is my pleasure and honor to be the moderator of this important event to launch IBP's report, Managing COVID Funds, the Accountability Gap. The COVID crisis is far from over, as the pandemic continues unabated in many parts of the world, and governments are still struggling to implement measures to support their populations. Many voices are calling on governments to implement their crisis-related actions transparently, inclusively, and to ensure effective oversight processes can be conducted. Such steps, they believe, will help to ensure that assistance reaches those who need it the most. Transparency is also critical because the massive sums of monies that governments are spending on relief efforts are having short and long-term consequences on their public finances that need to be discussed and debated as tough trade-offs lie ahead. Against this backdrop, we have a packed agenda for today. We will begin with a presentation of IBP's COVID Accountability Report and then invite questions from the audience. We will then hold a panel discussion, and I will introduce the panel at that time and ask each panelist a couple of questions. And then also, of course, allow audience members who will have the opportunity for questions to our panelists. Some of you have already sent us questions in advance. For those who wish to submit additional questions, please use the Q&A function on your screen or type your questions there. Some questions will be addressed during the event, while the remaining questions will be answered after the event if we can't get to all questions. So please bear with us in that respect. So let's begin by hearing a presentation of IBP's COVID Accountability Report from Vivek Ramkumar, Senior Director of Policy at IBP. In this capacity, he oversees IBP's research and advocacy efforts to expand the adoption of transparent and accountable budget systems around the world. Previously, he worked with civic groups in India on a variety of governance and development issues. So, Vivek, over to you for what will be a very, very interesting presentation of the report. Vivek, please.
Thank you, Sophia, and hello, everyone. Thank you for joining us and giving us this opportunity to speak with you about our new report on accountability in COVID-related spending. Over the past year, we've all seen widespread media coverage on the spread of the pandemic and on government plans to combat the crisis. We've also heard many stories on abuse of public monies by unscrupulous officials and corrupt actors. But what we have not seen is adequate coverage on the systems that need to be put in place to curb abuse of funds and to ensure that they are reaching their intended targets and beneficiaries. Our report focuses on this precise issue. When the COVID pandemic broke in early 2020, there was near unanimous consent that a crisis of this magnitude required governments to act boldly and swiftly to meet the needs of their people. By the end of 2020, governments mobilized a staggering $14 trillion in fiscal policy responses of different types. While welcoming these responses, a chorus of voices, including ours, urged governments to put in place the transparency and accountability arrangements necessary to ensure that the massive resources being mobilized did not go to waste. Responding to the crisis in an open and accountable manner was a way for governments to restore public trust and build back better. The International Monetary Fund told governments Do whatever it takes, but keep your receipts and encourage governments to take practical actions to safeguard their funds by reporting on implementation of policy initiatives, adopting open procurement processes, and publishing expedited audits of crisis-related spending. Near the end of 2020, we brought together a group of experts to develop an assessment of how governments manage their initial emergency fiscal policy responses. Our goal was not just to assess how governments fared, but also to generate lessons on how they can respond better, both to the ongoing crisis and to future ones. The research focused on three critical pillars of fiscal accountability, namely public access to budget information, adequate budget oversight arrangements, and opportunities for public engagement in budgeting. Each pillar is essential to ensuring resources are used effectively, that people's basic needs and priorities are adequately addressed, and that governments can be held accountable for their choices. Working with civil society researchers in 120 countries, we documented the introduction of almost 400 emergency fiscal policy packages from March to September 2020 and assessed the largest or most important of these packages in each country. Our assessment shows that more than 2/3 of surveyed governments are falling short of managing their fiscal responses in a transparent and accountable manner, thereby jeopardizing the effectiveness and impact of their responses to the crisis. These shortcuts and limitations are neither necessary nor inevitable. Many countries across regions and incomes have chosen a different path. An urgent and speedy response does not have to come at the expense of accountability. There are three key findings from our COVID accountability report that I share with you. First, governments have failed to adopt key measures to enhance accountability that many voices had demanded when governments began to announce their relief packages. Only in about a quarter of countries assessed were auditors able to produce and publish audit reports on COVID fiscal packages before the end of 2020. About half of the governments surveyed published little information on the implementation of policy initiatives, and approximately 2/3 of surveyed countries failed to follow transparent procurement procedures. Despite this, some countries have shown a different way is possible. For example, Paraguay has a one-stop shop site that publishes information on all pandemic-related procurement. In Jamaica, the Auditor General published 3 concurrent audit reviews of the government's cash transfer program, and the Ministry of Finance worked closely with the National Audit Office to follow up on audit recommendations. Recognizing the disproportionate impact of the pandemic on women, Canada, the Philippines, and Sweden published a gender impact assessment of their own COVID-19 responses. And in Togo, in a short period of 10 days, the government established a transparent platform for a cash transfer program that prioritized women. A second finding in our report is that the role of legislatures has been limited during the pandemic. In almost half the countries in our assessment, governments introduced fiscal policy measures through executive decrees, sidestepping normal legislative and approval processes and preventing public debate. Not surprisingly, countries that bypassed their legislatures were also generally less transparent in their COVID-related spending. Again, some countries showed that a better way is possible. For example, in Nepal, the Parliamentary Accounts Committee investigated irregularities in procuring medical equipment and supplies to hold to account those responsible for these failures. In the Philippines, weekly reports on COVID-19 response actions are sent to a joint congressional oversight committee that oversees implementation. A third finding in our report is that public participation in the formulation and execution of COVID policy responses is virtually non-existent. This has not only excluded the public from having a voice in decisions on priority setting during the pandemic, but it has also deprived governments of inputs which could greatly improve the effectiveness of their actions. Only 10 out of 120 countries made any meaningful efforts at engaging with their populations in the design and oversight of relief monies. Even as governments largely kept the public at bay, civil society groups have been active in mobilizing local communities and amplifying their needs to government. One of the most successful examples of civil society and government collaboration is the Asivikelani initiative in South Africa, which is giving an active voice to informal settlement residents in major cities who are faced with severe basic service shortages during the crisis. Through targeted advocacy and campaigns, the initiative has already secured improved access to water, sanitation, and waste removal services from municipal governments, affecting more than 1 million people. There are practical steps governments and donors can take to bolster accountability as part of the ongoing response to Build Back Better. Governments can adopt reforms now, such as publishing monthly progress reports and disclosing procurement details in open formats. They can plus up resources for national auditors to conduct expedited audits and take remedial measures in response to their audit reports. They can take actions to restore legislative oversight. Further, they can also leverage existing mechanisms in the executive, legislatures, and within national audit offices to facilitate citizen participation in the formulation, approval, and execution of new COVID-related packages. Over the long term, governments can strengthen systems in the annual budget cycle to be better prepared for future crises. These include reforming legal and regulatory frameworks to clarify roles and responsibilities in areas such as procurement, oversight, and participation. They can also integrate innovations that emerged from this crisis, such as providing user-centered information. The international donor community can play an important role in advancing accountability norms in emergency spending. As part of their assistance, donors should urge and support country-led efforts to publish more information about what governments are spending and its impacts, and to facilitate oversight by legislatures, auditors, and citizens. Let me conclude by re-emphasizing that the COVID crisis is far from over. We must keep mobilizing resources for the global COVID response, including filling the funding gap for COVAX, to ensure everyone has equitable access to vaccines. But if we are serious about equity and justice, we must simultaneously get serious about accountability. This is about ensuring assistance reaches those who need it most. When governments do not deliver as promised, underserved communities bear the brunt. Thank you.
Thank you, Vivek, for sharing these very interesting findings. We actually have already received a few questions for you. So let's ask you first a few questions before we go into the panel dialogue. And I'll present the panel in a minute. So Vivek, how is the performance of government in investing in reducing unpaid care work among women, which, as we all know, unpaid care work for women has increased due to lockdowns and stay-at-home orders? Can you give us the sense whether the study sheds some light on this? Please, Vivek.
Yes, thank you, Sophia. I think that's a really important question. We know, or should know, just from our lived experiences over the last year, that women and girls all around us have been disproportionately impacted by the crisis, especially on issues related to looking after families, whether it's young children or the elderly. Our study focuses on the availability of budget data on how budget programs are impacting men and women. And our assessment showed that only 22 out of 120 countries publish relevant gender-related data in their budgets. What this means is that in 98 countries, it would be very difficult to assess government budget policies and programs on how they are supporting women and girls in their countries, including on unpaid care work. Only 3 countries, Canada, Sweden, and the Philippines, published gender impact assessments. This situation can and must change. Data paucity on how different segments of the population get impacted by government budget programs need to be improved on.
Thank you, Vivek. Another, I think, probably question which might be on everyone's mind is, how does one call for accountability when survival issues weigh heavily on everyone's mind? So, you know, calling for accountability when lives are at stake. So what do you think, Vivek, about this really important question?
Yes, Sophia, we've got asked this question quite a bit over the last 14, 15 months since the pandemic broke out, and many of us began to already ask governments and other stakeholders on how they are going to address accountability needs. One of the first questions that was thrown to us is there even time to focus on these issues? Now, our answer has been fairly consistent on this. We don't think that there is a trade-off between an emergency response and the strengthening of that response. We don't think that a crisis can be an excuse for abuse of public funds. Accountability has to be given primacy. Now, this question has been asked of many others demanding accountability for decades. I want to actually give an example, an anecdote of a former colleague of mine from India who'd received very little formal education. He's in the village in India. And he was attending a meeting organized by the government on right to information when it was being taken up at that time, the legal framework of it. And he was in a stage and he was asked that, you know, we're running short of time and we have 2 minutes for you. Come and say what you want to say about why you think legislation on right to information is important for you. So he took to the stage and said, you've given me 2 minutes, but what I need to say, I can say in 30 seconds. We, the poor, think of right to information in terms of our lives and livelihoods. You, pointing to the government officials, he said, think of right to information in terms of its impact on your seats of authority and power. But somewhere down the road, we both need to come together and think of right to information in terms of the future of our societies and our nation. I think it's in that spirit that we call on governments to be open and inclusive during times of crisis, take their public into confidence and work with them to formulating and implementing the best responses that the crisis deserves.
Thank you. Thank you, Vivek. I couldn't agree more. And I think another really important question is that also has come from the audience. Can you give us a sense whether there was a relationship between country performance on your report and the levels of corruption in these countries? Was there any relationship between performance on accountability and corruption?
What we have found is that our results on accountability are moderately correlated with corruption indices that are out there. And this is fairly consistent with previous data on budget transparency that we've also published through our open budget survey that shows a link between levels of transparency and the existence of corruption in countries. Now, what we know about transparency is that it can be tangibly achieved. We know through our open budget survey that governments can achieve a 20% bump in transparency almost overnight and almost free of cost, simply if they publish budget information and data that they already possess in their existing websites. What we've also seen from our data, though, is a slight paradox, that countries that are more open are also countries in which media is more active and they are reporting on cases of corruption, while in closed societies, it is harder to find cases of corruption being reported openly in the public by the media. Now, we think it is critical that governments address corruption and equity issues. But for that to happen, many short and long-term measures may need to be taken. For example, governments need to address the structural causes of inequality in countries, which create power imbalances and the enabling environment for corruption to take place. Governments and societies also need to address norms and practices that encourage or at least tolerate the culture of bribe giving and bribe taking. But as a first step, we think all governments should publish budget information and become transparent, and thereby close one door through which corruption exists.
Thank you, Vivek. Thank you so very much. I'll think for now, if that's all right, we'll move to the panel dialogue. And then please remember, dear audience, that there will be the opportunity also to ask your questions to panelists and to Vivek as well, if questions arise as you hear the debate. So let us move to the panel discussion. We are honored to be joined by 4 very highly accomplished panelists. First, we have Mr. Nazir Kabiri. He's Deputy Minister for Policy in Afghanistan. And Afghanistan has really worked on strengthening transparency and budget execution practices. So we are very honored to have Mr. Kabiri with us. Next, we have Mr. Michael Aguinaldo, the head of the Supreme Audit Institution of the Philippines. Mr. Aguinaldo is a lawyer with extensive experience in governance and administration acquired from 23 years of professional work as private law practitioner, government official, and professor as well. Also, we have Mrs. Carolina Renteria, who is the chief of the Public Financial Management Division of the IMF's Fiscal Affairs Department. Among other issues, she is responsible for developing a comprehensive public finance management analytical agenda for countries in Europe, Anglophone Africa, in the Middle East, and Central Asia. She has also previously served in a number of senior roles in Colombia's finance ministry. And finally, last but not least, we have Shumani Luruli, Program Coordinator at Plan Act, a civil society organization based in South Africa that works to support and mobilize community processes that enhance good governance that alleviate poverty. During the COVID crisis, Shumani has played a leading role in giving voice to informal settlement residents in South Africa's major cities who have faced severe basic service shortages during the crisis. So let's start with the questions for our panelists. And it would be great if I can ask you, dear panelists, to keep questions to about 3-4 minutes so that we can hear from all and have more than one round of questions. So, Mr. Kabiri, let me ask the first question to you. In times of emergencies, such as the current one, our governments must balance the need for flexibility in the design and implementation for their emergency responses with the need for creating more open and accountable public finance systems that foster transparency and civic engagement. How can your government find a balance between these 2 objectives of speed and transparency? Give us a sense of what it looks like from the perspective of Afghanistan. Please, Mr. Kabiri.
Thank you, Sophia, for the kind introduction and for having us, Afghanistan, to be partnering with you in this discussion. My greetings to rest of the distinguished panelists. And of course, good morning, or perhaps good afternoon, or maybe good evening to some of you, and maybe in Philippines, of course. Again, thank you very much. This is a very timely discussion and a forward-looking one, perhaps. With respect to your question, I personally don't think there is an issue of balancing here in the Afghan context. The two, speed as well as the transparency are complementary needs. They need to be going hand in hand and together. For the benefit of this discussion, I must brief you on the context and the situation where the COVID hit Afghanistan back last year. We were at the midst of 4 crises simultaneously going on all together at the same time. There was already an elections crisis, which is a political crisis. There was an intensified war. And of course, COVID became a health crisis coupled with the economic crisis. Afghanistan being a landlocked country, our supply chains were all being stopped. The supply of essential goods and, of course, food and the rest. Inflation was an issue we were looking into to tackle. Relatively speaking, I think the government back then did really good. I was back in a think tank looking after the developments with respect to the government. Government was quick to realize that there's a pandemic. The Afghan government leadership was honest. The communication with the citizens were happening. Credit to our free media. True that Afghanistan is a conflict-affected country at the midst of the war, but our free press is the best in the region, compared at par with India and rest of the democracies in the neighborhood. So this is helping with the scrutiny. And again, the realism that there needs to be a fiscal response to this question, to this situation was rapid. Restructuring is started. There was a good degree of communication between the development agencies, humanitarian, as well as the media, and also coordination with the NGOs. Some credit to the UN and rest of the non-government NGOs present across the country. This restructuring happened relatively quickly. The design, of course, had some issues, and some of the programs could have been delivered better. We designed a $300 million food distribution program. But again, this could have been perhaps, and that was in kind, provided of the Afghan geography and complications and insecurity. Some mismanagement, of course, were reported. This was a little too natural in a context and a difficult geography in a war-torn country like Afghanistan. This food distribution was a complication. Unlike countries like Iran and Pakistan in our neighborhood, we did not consider the hybrid model of food plus cash transfer. Now that we evaluate the infrastructure for cash transfer through the digital system was already in place, that we perhaps neglected to consider that back in the day. But again, with respect to your question and to do with the transparency, our understanding is that in the times of emergency, it's actually more important to be open and accountable government, and be very open about when we cut corners to save time so that we can save lives. And also this really tested our systems, our procurement law particularly. President had to sign a decree to simplify some of the rules. For example, in the northern and the eastern province of Herat, which was the epicenter of the COVID, we did have money, but we couldn't disperse due to the cumbersome procurement complications and laws. So that really tested our systems, but the government was quick to respond so the procurement could happen. And those, but at the heart of this is, of course, honest and sincere communication. And I would end with a point with respect to our development partners. Half of Afghanistan's budget is financed by our development partners. while there were not much of new pledges, reallocating some of the portfolios and re-advertising to the people creates a sense of misunderstanding. Where is this money coming from and where does it go? A lot of those money were not new money, and at the same time were for long-term system building of the healthcare systems and the rest. But too much repetitive communication and strategic communication was at the heart of it. So that created a sense of expectation. It increased people's expectation, but delivery at this level. And those could have been better communicated by our development partners, that a lot of those money were not new money, but were from restructuring portfolios. Again, I will be at your disposal to continue when there's a question.
Thank you, Mr. Kabiri. I think it's really important what you said, that in a crisis one should not cut corners. Thank you so much for sharing these thoughts. Let me come to you, Mrs. Renteria. Globally, governments have been widely encouraged to spend monies to combat the debilitating health and economic impacts of the COVID crisis, and to quote the IMF, do whatever it takes, but keep your receipts. So embedded in this advice are assumptions around accountability in the use of monies by governments. You see from IBP's findings that many countries have fallen short. But tell us why we should still be optimistic. In other words, what have you seen countries do to meet their commitments for transparency and accountability? And how has the IMF been helping? Mrs. Renteria, over to you.
Thank you, Sophia, very much. And thank you, everybody. Welcome to my colleagues in the panel and to everybody who is hearing us. And thank you for this opportunity. I would like first to congratulate the IBP on this excellent initiative. The assessment identified a host of country experiences that serve as valuable lessons to countries of all levels of capacity and income groups going forward. We were very happy to support this initiative in its design stages. As early as April 2020, the IMF had advised countries to do whatever it takes to protect lives and livelihoods, but keep the receipts. We also said that keeping the receipt was not going to be as easy as it sounds, and the survey demonstrates this. But I think we can be optimistic for at least three reasons. Countries have shown that it is possible to get things right, even in low capacity environments. Second, there are many innovative practices that have emerged during this pandemic and we can learn from. And third, there is still time to address some of the issues and we should focus on this. The report provides many country examples, but let me zoom in on Sierra Leone, a fragile state that scores relatively well on the assessment. COVID-19 is the second epidemic to hit Sierra Leone in 5 years. It was widely documented that the Ebola response in Sierra Leone was slow, fragmented across a number of extra budgetary funds, and fraught with irregularities as identified in 2 audits by the Supreme Audit Institution. But Sierra Leone learned, and fast forward to April 2020. The authorities quickly set up a single entity to centralize their COVID response, backed by legislation that established the standards under which it should operate, and they also passed procurement legislation that sets reasonably high standards for procurement under emergency. The audit services undertook a real-time audit of the operations of this entity, which received attention of the Parliament and public at large. However, despite the efforts to get things right under COVID, the audit still identified many irregularities that are being addressed. We in the fund supported the implementation of some of these measures because we worked on demand. We really tried to be by the countries when they needed our support. Let me turn to my second point for optimism, innovative practices. Many countries built on recent reforms of their PFM systems to track, report, control, and oversee their COVID-19 response. Some countries have implemented their measures through normal budget processes and financial management information systems, while others established dedicated COVID-19 funds to centralize their emergency response and keep an audit trail. Some additional practices include establishing dedicated portals to report on their spending, including on the beneficiaries, like in Brazil, Colombia, France, Honduras, and Peru. Adding a module in their e-procurement platforms that presented detailed information on emergency procurement related to COVID-19 in Honduras, Colombia, and Ukraine. Amending the procurement legal framework to require the collection of beneficial ownership information on all public contracts on a permanent basis. Allowing civil society and the media to play a role of external oversight. The Latin American Journalist Network for Transparency and Anti-Corruption, Red Palta, had used procurement data for 7 Latin American countries to publish articles tracing overpricing and corruption in the purchase of medical equipment. And there many countries set up real-time audits to tackle government's irregularities, such as what happened in South Africa, which was really powerful. The latest IMF Fiscal Monitor of April 2021 provides more details around these innovative practices. How did we help? We pressed for better governance through greater transparency and sought specific governance measures for countries receiving IMF financing during the crisis. These included commitments to track and report on COVID-19 spending, to publish pandemic-related procurement contracts and the beneficial ownerships of companies awarded these contracts, and to undertake export audits and publish the results. Countries have committed to these measures in their letter of intent when accessing rapid financing from the fund. These measures are tailored to country circumstances and the severity of corruption risks. In addition, all recipient countries commit to undertake a safeguards assessment, a due diligence exercise that is aimed at ensuring that a country's central bank is able to provide reliable information and transparently manage the funds that receives from the fund. But we also realize that addressing corruption is a long game and deeper challenges need to be addressed. This is why longer-term governance and corruption vulnerabilities will continue to be addressed under the IMF's 2018 framework for enhanced fund engagement on governance, with a focus on multi-year lending arrangements, annual health checks of IMF member countries, and capacity development. This is all work in progress, but we work with our member countries and we are seeing that we are moving in the right path. Thank you.
Thank you very much. And thank you for the examples of innovative practices. Thank you very much. Mr. Aguinaldo, let me come to you. IBP's COVID accountability reports finds that last year, few national audit offices were able to conduct real-time or expedited audits on COVID funds. But your office in the Philippines was one of the exceptions. So how were you able to secure financial resources, create a work plan, and access information from audited entities for conducting expedited audits in the face of the pandemic? Share with us the recipe, Mr. Aguinaldo, please, over to you.
Yeah, good morning, good afternoon, and good evening. Thank you, Sophia. Maybe at the outset, let me say that when you talk about audit, of course, the scope is really quite broad. And so were we able to do some real-time and expedited audits? Yes. But not everything was done in that manner because obviously when it comes to utilization of funding, there is really a time lag that you go through. So, and at the same time, when you're in an emergency situation, and here in the Philippines, we often find ourselves in emergency situations. If it's not, this type of pandemic, it's a typhoon or an earthquake or a volcanic eruption and so on. So to some extent, we're used to this type of situations. And so one of the key things we did was anticipate. So early on, when we saw what was happening, we sat down and said, okay, what are we looking at? We're looking at, hospitals being overwhelmed. We're looking at, potential lockdowns. We're looking at people being out of work and so on. So how do you think government's going to respond? And obviously you have some kind of social amelioration. Obviously they'll need to increase support for hospitals and the like. So as part of looking at risk-based or doing risk-based audit, you look at these factors and try and already anticipate what's going to happen, where's the money going to flow, what's going to be done, what do we need to do to prepare for this. Now, that's why I was saying there's some areas that you couldn't really do real-time audit without perhaps unduly interfering with the work that's being done. So you can imagine a government hospital, their hands are full. So it's very difficult to be standing there and, saying, oh, give me this paper, give me that paper. As Ms. Renteria said, keeping the receipts, yes, but it's not always that easy to do it, to remind people, especially when you're in life and death situations where, the focus should be on that. But that said, because we were able to anticipate, we, were able to follow the money trail right away, disbursements, releases of funds and the like. Some services that were not as urgent, but were still part of the process we looked into. And to be fair, there were some actions also on the part of government that created this transparency. So our legislature passed 2 laws specifically to address the COVID crisis. A lot of funding involved, but they did require periodic weekly reporting from the national government. And these weekly reports were published. And so everyone could actually see, where the money was going, which departments, what it was being spent on, and so on. Of course, the actual audit of those expenditures is being done right now. But that early, you could already see that kind of transparency. And another thing I have to give credit to the government as well is under those laws, the president could have not been subject to any procurement rules. In other words, he could suspend procurement rules altogether. But credit the government, they said, no, we will still follow emergency procurement protocols and procedures. So there was still a system that was kept in place. And I credit the government for that, because they could have just said, oh, let's just go ahead and buy. But no, they said, no, there has to be some structure, because Vivek mentioned earlier, it's not an excuse to abuse. But whenever you have these type of crises, it's always an opportunity to abuse. And we've seen that, time and time again. It really does happen. It's not an excuse, but it's an opportunity. It's done. That's why the transparency and accountability become even more important. But again, the key thing is anticipating, trying to think 1 or 2 steps ahead. One of the things we did early on was already come up with guidelines on how to audit COVID fund expenditures. And I think that was important, because it's just culling whatever laws had come out and trying to, analyze it and put it in such a format. Just one key point before I go, it's very important, because to give this example, early on they said you have to wear surgical masks. And surgical masks in our country back in March of 2020 probably cost about, the standard price was maybe about 60 American cents. But lo and behold, you could not find any mask, surgical mask, that would cost less than $1, at that point. Why? It's simple law of supply and demand. And so that's something I stressed in the guidelines. You have to be considered rules of reasonableness and circumstances. Buying, procuring surgical masks back in March or April of last year at over $1 a piece, I wouldn't say that's overpriced, even if it were overpriced in normal situations. But fast forward 6 months later, buying a surgical mask at $1 or even 70 cents might be bad, because now there was a glut. So it's nothing's cast in stone. There are moving targets. So let me end at that. Thank you.
Thank you. Thank you very, very much. And your thoughts are really, really important. A crisis is an opportunity to abuse and can be abused. Anticipation is part, and anticipating that possibility is truly what assured you to have the success you had. So thank you very much. Last but not least, let me come to Mrs. Luruli from Plan Act South Africa. And Mrs. Luruli, IBP's COVID Accountability Report mentions an initiative in South Africa called Asivikelane, and it highlights it as a model for how civic actors can come together and engage with government to deal with severe basic service shortages during the COVID-19 crisis. So can you describe Asivikelane and how it has been making a difference in South Africa during the COVID crisis. Mrs. Luroli, over to you.
Let me start by saying good morning, good afternoon, good evening for those who are with us today. And thank you very much for the opportunity to share the amazing work that civil society organizations are doing in South Africa with partnership to IBP SA. Yes, it's been quite interesting to find ourselves in this position, in this time in our lives. Let me maybe just give a brief background that most of the civil society organizations that I'm representing has been working in the space of accountability and transparency. We have partnered with IBPSA because the issues of municipal budgets, the issues of government spending has been central to the work that we do in South Africa as civil society organizations. So we found ourselves at a crossroads when we were hit by the pandemic. And it was either that we are going to curl up and sleep in our homes and keep quiet, or we were going to continue and push the agenda for transparency and accountability and really make sure the voices of the voiceless and the vulnerable communities are amplified. I'm talking on behalf of communities that are poor, communities that we call informal because they don't have services, they lack basic services. When the services are there, there is a whole lot of erratic behavior. But maybe let me quickly share with you what asivikelane is. This is a word that became a lifesaver for many. It's a Zulu word here in South Africa that means let us protect each other. And when we call on protection, it was at the backdrop of what government has started doing. Our government called on people in South Africa to a lockdown. And by that time, it was horrible. We didn't know how it will look like. And I'm talking about communities that are vulnerable. The government calls on us to say, you need to wear a mask. You need to social distance. You need to wash your hands. And immediately they say those things, we realize that, no, there is something that needs to be done. I'm talking about keeping a social distance when you are supposed to go and queue outside there to get water. We are talking about washing your hands every day when you have to walk some distance to try and get the very same water that you should be washing your hands with for 20 seconds. So for us, when we say protect each other, it didn't just mean wearing this mask, washing hands, and keeping our distances. It also meant that government needs to protect people in terms of basic services. It meant the basic services that community needs to ensure that they keep healthy and can observe the social distances as well. It also meant that as a community, we need to protect each other. Hence, we activated communities to say, when government is saying, keep your distance, we know very well that you might not be able to do it when you go out to look for water. But we provided information as to how can you share the communal facilities that you are sharing. So a number of civil society organizations partnered with IBPSA to establish this campaign that made it possible to respond to the needs at a grassroots level while observing the lockdown rules as well. The campaign, as we speak, is spread across 234 settlements, across 8 of our metros in South Africa, the big cities, and across 7 of our local municipalities that are small towns. In each informal settlement, we have mobilized a number of community members who are responsible to observe and analyze the service challenges they face and give us a report by answering several questions once a month. They use their cell phones to communicate under the lockdown regulations. Who knew that cell phones will come in handy and be a lifesaver here in South Africa? Most people thought that we just use our cell phones to communicate, to share pictures and all that. But with us, it became a lifesaver. And of course, there were so many challenges with that because I'm talking of settlements that don't even have electricity. People should make provision to say, how do I charge my cell phone to make sure that I report the challenges I'm facing so that life can be bearable in this pandemic. As partner organizations, we worked with community leaders who always update about the challenges and give evidence. And the evidence that we're talking about would be, are they getting the water as they're supposed to get? Is water delivered in time? Is their ablution blocks cleaned? So they will give us evidence, maybe with pictures that shows those challenges, or they will take videos that would talk to what they are suffering about. Because remember, at that time, we couldn't even be out there to see for ourselves. So those gadgets came in very handy. We have a team of community facilitators in strategic areas who are instrumental to share information for education, but also give feedback to community after engagement with government. So we knew that as civil society organizations, staying at our home, also observing the lockdown regulations, we couldn't be out there, but we had people already mobilized, people who have been working tirelessly in their communities to ensure that there is development, there is basic services, and we started working with them closely. And we call them community facilitators because they do over and above that we are able to do. So they work closely with us. Many services for informal settlements, as I've indicated, are communal, such as your ablution blocks and water taps. There are pit latrines and plastic mobile toilets. Water is through JoJo tanks. Probably some people understand that. You know, there are these plastic tanks that are put up in the strategic places on the streets, and trucks will come and fill them with water. And people have to go and get their fill of water for a day from there. Water is through that. Facilitators was started at the beginning of the COVID crisis to help collect information directly from informal settlements residents, as I've already alluded to. They monitor how these services are provided, and if there are challenges, they take pictures and share with us. Asifikelane gave an organized platform where informal settlements voices could be raised directly with government, with actual data on the services that affect them. So Asifikelane gave us that opportunity. And as we speak across the country, and as Vivek has alluded to, we saw government responded to the campaign, including the National Ministry of Human Settlement, Water and Sanitation. They increased access to mobile toilets, increased access to water tanks where there was none or where there was little. Because in South Africa, one of the policies for these services in informal settlements, they'll say for a mobile toilet, they give one toilet for 5 families. Hence, we felt that that was not enough and it was not good for the health of the masses during the crisis. But we saw our government responding and making sure that people get the basic needs and they are met. This was done through the engagement we had at local municipalities, on the local municipal level, but also at a level of the metro and level of national government. The National Department of Human Settlement, Water and Sanitation created a task team that brought together government officials from different departments and the different spheres of government. Because in South Africa, you have your national department, you have your provincial department, and you will have your local municipality with all those units responsible. So at least by the time government created that task team where everybody was listening, and we got that platform through Asivikelane. These kinds of forums made sure that government responded and made sure that residents of informal settlements could access the basic services needed to protect them. I think, yes, there are some lessons that comes with that. And I think we have seen that we cannot expect people to stay at home and just keep quiet. We cannot expect the vulnerable members of our community to stay at home and not share those communal facilities, but we needed to make sure that when they share them, there is proper and healthier environment for them. We need to make sure that communities were engaged to hear their voices and get government to respond quickly. Asivikelane managed to amplify those voices. We see that when communities amplify their voices, especially for a specific issue, government is bound to listen. When we mobilize and communicate, and we must mobilize with information. I've given you a background to say we work with IBPSA to look at municipal budgets, we share those information, and that gives the communities the ammunition because they have information. So when we mobilize them and give them that information on budgets and service standards, they can tell government what their needs are and what the standards should be because they are the users of the services. But maybe lastly, if I can say, the important lesson is about mobilization. It's about an active citizenry, people that are not just complacent, but people who stand up and do something about it. And it is about the government engagement. We know that it's very difficult in other instances, but we found that during this period, it was something that we couldn't ignore to make sure that we engage with government, both politicians and administration. It was very important. It was also very important for us to identify champions within these municipalities who are sympathetic to the needs. So that was one of the biggest lessons that we are drawing to say, within governments, there are people who are very much sympathetic and they do give an ear when citizens raise concerns. And we have seen that during this pandemic. Thank you very much.
Thank you very much. Thank you very much. And in order to allow as many questions from the audience as possible, can I ask you all, please, if you can keep your responses for the next round to about 2 minutes max, that would be brilliant. And thank you very much, Mrs. Luroli, for that detailed account on the experience in South Africa from the perspective of civil society. So, Mr. Aguinaldo, let me come back to you. We just heard a really interesting account from South Africa. Can you give us a sense of how you are working with civil society organizations in audits of COVID programs and what results have been and what results you have seen from this engagement? It would be great to hear the experience from the Philippines in that regard.
Well, it's been a different challenge from the types of citizen participatory audits we've done in the past, mainly because of the mobility restrictions, because of the quarantines and lockdowns and all that. But early on, civil society was very active in monitoring the amount of money that was being disbursed. But like I said, there were weekly reports. So the data was actually there. So eventually, the monitoring sort of waned because there was no need, because the data was actually there. I guess at the start, they just wanted to make sure that their government is, true to its word. But something happened along the way that didn't involve us or even the government itself. Viber groups, social media groups were formed by people with common interests. And the commonality usually is the residents of the same town or the same city or the same, area. And they would then now exchange information about various things, whether it be social amelioration, whether people are getting the money already, what problems are being encountered. Now it's the vaccines, the difficulty of having to line up, questions about, why is this person getting it before I do, when there is a priority list, So now citizens are actually doing it on a very democratic, unorganized level. There's no central authority. There's just a sounding board. And what happens is all this feedback that comes in are filtered out. They're discussed. Sometimes, vigorous discussion goes on. Fortunately, nothing violent yet. And the end result is usually feedback given to the local government. And the local government then is able to respond, is able to correct information, or the local government adjusts, to meet that. And so what's happening now is, the citizenry actually taking the cudgels already, trying to assert themselves and saying, hey, this is the way things should be. No, that's not fair. And it's now, gone to different issues like traffic, like bike lanes and things like that. So really, really beautiful, because it's not something that the kind of citizen audit that we've done in the past where we take the lead with the civil society organization. Now it's civil society, not even organizations, but civil society doing it on their own. And I think it's been very healthy, I think, even though, there could be some dangers there of, misuse, false information being fed, but it also has become a way to weed out fake news. Whenever they post something from YouTube, and then, say, no, that's fake news, that's not true, and so on. And so it's actually been surprising. And you have pockets all over the country that, where this goes on. So it's very exciting, actually.
Thank you. It is indeed quite exciting. Mr. Kabiri, let me come back to you. And again, if we can all keep responses at this stage to about 2-3 minutes, so that there's actually quite a few questions from the audience. So let's try to cover as many as we can. Mr. Kabiri, countries have responded to the COVID crisis by investing massive sums of monies in relief and recovery efforts. Much more will be needed in the coming years in order to alleviate the long-term consequences of the crisis. However, countries are also going to confront mounting debt, reduced revenues, and increased fiscal constraints. So how can countries manage these many fiscal pressures and still work to stem increasing inequality and the widening gap between the haves and haves not that will result from the COVID crisis everywhere in the world? But give us a sense of what may be feasible in Afghanistan and how you will tackle this widening gap between those that are more discriminated against and excluded and those that live with greater privilege.
Sure, thank you. And the nature of the Afghan economy is different than the rest of us, at least in this conversation. The economy contracted somewhat 2%, and that also due to the supply chains being disrupted. There's a large informal sector that exists, and also the country is heavily reliant on international aid. 75% of the public expenditure is being paid for on and off budget by the international aid. To that end, the health crisis, thanks God, didn't materialize the way it emerged elsewhere, at least in India or in Iran. So to that end, we are sort of moving away from a narrative of COVID restructuring or COVID response back to the normal. Provided the ongoing emergencies with respect to the delivering services to the people, we are fighting an enemy, an illegitimate war on their side. And what we have to respond is our fiscal resources, and those addressed to the basic services to do with the health and education. To that end, we are using this COVID opportunity to further restructure some of the very bad performing projects. And we are also taking the opportunity to move away from an auction-based corrupt budgeting practice to that of a policy performance-based budgeting. We are using the opportunity to stop some of the non-performing projects. We are reassessing the capacity of our ministries. We are moving away from the narrative of big mega development projects where the capacity is limited on the side of the government institutions to deliver on those. So to that end, provided whether it's a fiscal crisis of this nature or other, we shouldn't lose sight of our job at hand, which is to deliver for and on behalf of our people, and to raise money where it hurts the least, and third, to spend where it has the biggest impact. And for us, and it brings a lot of legitimacy to my government, and that has to do with the basic services in terms of health, education, and rural development. And moving forward, we have designed a national accountability portal to be also mindful of the transparency of the expenditure. And those two are launched. The two modules are being launched today, and it's a pleasure to announce that the Afghanistan Risk Portal is being launched. And the second, Afghanistan's Fiscal Intelligence System is being launched. So to that end, we are using the fiscal pressure and the opportunity to be restructuring and making sure that we deliver on most of the basic services to our citizens that could bring a lot of legitimacy to our government.
Thank you very much, Mr. Kabiri. I love that. Raise where it hurts the least and spend where it has the greatest impact. Thank you so very much. Mrs. Renteria, let me come back to you, because actually the audience would like to also hear your response to the same question. That is, how do you think countries can manage fiscal pressures and still work to address inequality, the mounting inequality that will result from the COVID crisis? And let me weave in a second question from the audience, which is, for countries that have not yet incorporated a gender-focused budget, where do you suggest those countries start? What is the starting point to incorporate a gender-focused budget? Mrs. Renteria, over to you.
Thank you, Sophia. This is a very important question that contains several points, and I will try to unpack in 2 minutes. So first, as we all know, countries have spent a lot during COVID, 16 trillion in fiscal action in 1 year. Countries have run large deficits in 2020. Many continue to do so in 2021. And as a consequence, global public debt has increased to reach 97% of GDP in 2020. But second, there are differences across countries, and this is very important. Advanced economies which have access to capital markets have been able to respond more forcefully to the crisis than low-income countries. Through more expansion vaccination programs, they are also likely to emerge earlier from the crisis. As highlighted by our managing director, Kristalina Georgieva, there is the great risk of global divergence. In other words, as advanced economies and few emerging markets recover faster, most developing and low-income countries can languish for years to come. The MD has also highlighted the emerging market and low-income nations could face difficult choices between maintaining macroeconomic stability, tackling the health crisis, and meeting people's basic needs. And the vulnerable countries will need substantial support as part of a comprehensive effort. Coordinated, multifaceted, and strong response is needed. The first stop belongs to the countries, and I'm really happy to hear what Afghanistan, for example, is doing. Government should raise more domestic revenue. They should make public spending more efficient, reduce waste, and prevent misuse of funds while improving the business environment. At the same time, international efforts are critical to further scale up concessional financing and leverage private finance. There is the option of an USDR allocation, which could add substantial direct liquidity boost to countries without adding to debt burdens. It could also expand the capacity of bilateral donors to provide new resources for concessional support, including for health spending. Following a comprehensive approach also means dealing with debt. The G20's debt service suspension initiative quickly freed up vital resources. And the new common framework aims to facilitate timely and orderly debt treatments for eligible countries with broad creditor participation, including the private sector. The IMF has stepped up in an unprecedented manner by providing over $105 billion in new financing to 85 countries and debt service relief to the poorest members. The third point of your question and the second question is the difference countries within countries, with some groups bearing the economic and social brunt of the pandemic more than others. Following on Vivek's earlier intervention and the question you just made, let me give the example of how the budget can be designed to support women. COVID-19 crisis threatens decades of progress for women and girls, disproportionately impacting women's incomes, employment, and education opportunities, while growing pressures of unpaid care and increased gender-based violence has happened. Countries should deploy gender-responsive policies and budgeting, which will help to mitigate the short-term impacts while also addressing long-term structural drivers of gender inequality. Together with the UN, we address this issue in an upcoming note that examines how countries worldwide have taken up this challenge, drawing on the UN COVID-19 Global Gender Tracker response. We highlight that additional tax and expenditure policy recommendations to address the gender impacts of COVID-19, laying out the ways in which gender-responsive budgeting can support a strategic design and effective implementation of gender policies. I am really pleased to see that this survey highlighted examples of countries that have incorporated gender considerations into their policy responses to COVID. Action is needed, but it's not only in time of crisis. It is a continuous improvement of the budget and the PFM system, paying special attention to the gender needs and allowing to have gender disaggregated data. You can have a gender impact assessment in your circular for the budget process. You can give instructions on how to deal with gender. This is a work in progress, but the sooner countries start, the better and the sooner results will be there. And this crisis has helped to make even more evident why we need to pay special attention to vulnerable groups. Thank you.
Thank you. Thank you so very much. And thank you for the pointers on gender and including gender in budgets. Mr. Aguinaldo, there's one more question for you. And again, let's please keep it short at this stage. So I see 3 more questions. So Mr. Aguinaldo, the audits that you conduct are important, but how can we ensure that governments take remedial measures and institute accountability based on audit recommendations? Can you share some thoughts on that?
Well, audit can't be seen in isolation, you know. It's only part of the entire fiscal process of a country. So we do have a very limited degree of, you might say, punitive power, very, very limited. So really, a lot of the change has to come from the process itself. Our reports should be used by Congress whenever they do deliberations on the budget, you know, so that money that's not spent or not spent properly should, just be taken away from the budget of those agencies that are not able to utilize them. Our recommendations are reviewed annually, but to a certain extent, we don't really have the teeth to compel, and that's because I think the way the system is structured, it's really supposed to be a joint effort. It can't just be one, lording it over the others. So now our Congress has a Public Accounts Committee, and so they're now, looking at our reports more closely and using it sometimes, for the benefit of, rationalizing budgets that are granted out to these, or budgets that are being submitted by these agencies. So it's a process, and we're just part of that circle. I think if anyone who's been through a PIFA assessment will know that there is a circle of fiscal activity that you have to go through. And over the last few years, we've finally completed that circle. And so hopefully things get better as we get better at it as well. Thank you.
Thank you, Mr. Aguinaldo. And Mr. Kabiri, let me come back to you. There's one more question for you from the audience that says that many governments were managing the crisis by responding to it with off-budget spending. And that, of course, is critical in this context. But at the same time, there may be no time to follow the constitutional steps to have supplementary budget approved by lower houses or the parliament. So what do you think about this issue? Is it enough to have, for example, e-platforms to publish public cash flows in and out, or what can be done in a context of this kind? Mr. Kabiri, over to you.
Thank you very much. This is not an easy question to answer, but provided of the situation going on, we have been a little too hospitable to the NGO communities, and we are grateful to their presence all across the country. Those of them involved in the health sector, contracted by the government, and also in the rural development, and also those of the civil society that helped us with the information sharing and transparency. NGOs spend something around $800 million, close to $1 billion every year in Afghanistan. And those are mostly off-budget programs sponsored directly by the development agencies. So their presence, their nature of operation, their remoteness, and also due to their legal status not being associated directly to the government, they are more effective and efficient in terms of delivering services even to the conflict-affected areas. So to that end, they have been extremely helpful in delivering the services. The second largest program after the food distribution was another COVID response, something around $200 million for seed distribution and support to the agriculture sector is another example. But on the information system, we do have a centralized NGO data management system. And also for the off-budget, we do have another portal at the Ministry of Finance where development partners update their figures and data at the deliverable level, at the project level. So we do have a good sense of what is spent and where. But at the same time, we do encourage our international partners and everyone around the development community to possibly use the country systems. Continue using the country system gave us more sense of ownership. We are bringing legitimacy. The services gives the government more legitimacy in the eyes of the people, and that also brings accountability. These two are interlinked: accountability and legitimacy. So off-budget expenditure is a life saver, but at the same time difficult to account for, and O&M is another issue around the off-budget expenditure. So there are pros and cons to the both, but we are moving towards more efficient and effective and transparent budget where the fiduciary risks are being managed, more transparency brought, so we attract more on-budget resources.
Thank you. Thank you so very much, Mr. Kabiri. Mrs. Luruli, the last question before we start wrapping up this really fascinating panel comes to you. And I hope you can leave us with hope and optimism, because the audience would love to hear what your plans are, even beyond the COVID crisis, to sustain an important initiative like Asivikelani. So maybe in 2-3 minutes, give us a sense of how this initiative can be held up beyond COVID.
Thank you once more, Sophia. Indeed, this needs to be held up. And I think with us, what we are doing, we are continuing to mobilize more communities. We are continuing to mobilize across government and looking at other services like your health, like the environment. Already, I was talking about water and sanitation, but we are continuing to mobilize. So I'm saying that because when I talk of mobilizing, I'm talking about making sure that communities out there have information and they can engage at their own level with the information. So the issues around transparency from government side becomes very important. We are continuing to engage the media. Whatever information that we have, we take it out also to the media. Of course, we're not talking about spreading propaganda. We are talking about the real issues that affect communities. And when information is out there, it's better because people get engaged. The groups that Mike was talking about, we have a lot of that in South Africa. And once you start saying something out there, people rally around that issue up until somebody stands up and responds. So we are continuing to do that. We have seen it that it works. Thank you.
Thank you. That's a perfect way to end. I think let me really conclude this session. I think first by thanking Vivek and IBP for the fascinating report, for sharing the findings, the recommendations. Let me thank Mr. Kabiri, Mrs. Renteria, Mrs. Luruli, and Mr. Aguinaldo, all the panelists for your excellent presentations and remarks. And of course, the audience for asking really very substantive and great questions. Today's discussion has highlighted the need for accountability in our global effort to build back better after COVID. We hope that it has also sent a powerful signal to governments and other stakeholders that even during times of crisis, open budget practices are not only possible, but are essential to ensure assistance reaches those who need it the most. We heard in detail about the large gaps in accountability for the use of COVID relief funds that exist in many countries. And we learned about the good practices that several countries have instituted. We hope that these practices can inspire governments and other stakeholders to institute measures that enhance accountability in emergency spending now and during future crises. And Mr. Aguinaldo told us that crisis and Mr. Kabiri also in Afghanistan, in the Philippines, in South Africa are frequent and large. Therefore, the lessons learned should really serve all crises. As we leave today's discussion, let us remember that while public finance institutions and processes may appear to many people to be technical in nature, they ultimately serve a critical role for the public. That's why IBP's tagline is open budgets, transform lives. So let us continue to transform lives through open budgets. Thank you very much to all for joining us today. And thank you again to the distinguished panelists. Have a wonderful evening, afternoon, and week. Thank you very much.